Did you know that more than 100 million people are living with near to full blindness in sub-Saharan Africa? That's according to data from the International Agency for the Prevention of Blindness. Many report struggles with everyday life, such as information not being available in Braille or a lack of specialist eye doctors. However, in Uganda, home to more than 3 million blind people, a special village, home to a population of mainly blind and visually impaired people, has emerged. The BBC's Agnes Penda went to visit and discovered a community that has come together to support each other.
On the northern shores of Lake Victoria, Lubu village is home to a tight-knit community. Almost everyone who lives here is either blind or visually impaired. Every Monday, they meet and discuss their most pressing concerns. 53-year-old Moses Muigai is the village leader.
We talk about how we can support ourselves, how to keep our children in school, how we can feed them.
This enclave of about 10 houses was once a school for visually impaired children. It was set up by the local government and an NGO in the early 2000s when there was a high incidence of river blindness, a parasitic infection spread by black flies. The school eventually closed down, but many, like Moses, chose to stay.
When I first went blind, my life was deeply affected. I suffered from mental health related challenges because I thought it was the end of me. I worried about losing friends. Things that I would have to do became impossible.
Like Moses, Lubu's blind residents have had to adapt their lives with some help from sighted villagers.
What we first taught ourselves is togetherness. Our disability is our strength. Here, we support each other.
According to the International Agency for the Prevention of Blindness, roughly 3 million Ugandans are visually impaired. And there are very few eye doctors, especially in rural areas. Dr. Waiswa Julius is one of them.
If the government can increase the number of eye specialists per sub-county, I think it can do better.
Dr. Alfred Mubangizi, a public health official in the country's capital, Kampala, says the government is prioritizing health.
We are training doctors. The government has actually is encouraging many doctors to go for masters in ophthalmology.
Until there are more eye doctors working across rural Uganda, communities like Lubu look to each other for support.
There's no place for negativity towards people with blindness. We are normal human beings like anyone else.
A sense of unity and togetherness is one of the most unique characteristics of this village. And given its remote location, it may be the key to its survival. Agnes Penda, BBC News, Uganda.